My name is Chris Reykdal, State Superintendent of Public Instruction. We're coming to you from the old Capitol building here in Olympia, Washington. This moment of opportunity is grounded in a much bigger moment right now in the United States and around the world and right in our communities. I want to start with a very clear acknowledgement of this remarkable time in America where we are once again looking in the mirror at the systemic racism that has permeated our world. I want to unequivocally make clear the condemnation and the sense of frustration and injustice at the murders of our fellow citizens. This is not new, and it is sadly the work of all of us, in that we have an obligation to not let this just be a moment that goes by as it has in the past. This nation was founded upon fundamental principles of racism and gender discrimination. They were baked right into our US Constitution. And what has subsequently been the case is to make those institutionalized. They are permanent systems in virtually everything that we do. They are in our housing systems, our banking systems. They are in our education systems, our criminal justice systems, and so much more. It is our work to address this. And this national phenomenon that's occurring right now is not like anything in some ways we've ever seen before. It is led in very different ways by young people who are tired. Our communities of color are tired of this experience, and they need allies, and we have a responsibility to do that. At twice the police killings of their overall population, our Black African Americans are most at risk of this systemic racism, but it is permeating through lots of systems for lots of folks. At 2 times the COVID rate deaths, it's clearly in our healthcare system and in the way we respond to a virus. At 3 times the rate of incarcerations, it has been an unjust system for a very long time. The last 2 things I'll say about this in my intro is that there's a system that underwrites the whole thing, though, and that's economic injustice. We can make arrests and we can change laws at the federal or local level or the state level. But the systemic discrimination and bias against communities of color accessing capital and accessing resources, and at times not accessing education equitably, it disempowers and it causes us to regress back. And so let us take this moment to help our young people who are leading this in many ways to realize that this is about police violence, but that is one symptom of a much bigger system. And in that, I want to challenge our policymakers at the federal level, at the state level, at the local level. We're about ready to hit another recession. We're probably already in it. This is not the moment to go back to those systems of oppression through austerity. Cutting budgets as our first value is fundamentally a privileged value. It protects those who already have and does the most damage to those who need support. And so I am challenging all of us in the spaces where we are. And as an ally and as a white man of privilege, I have a responsibility to be an ally and fight in the spaces in which I am empowered. And as state superintendent, I intend to do that. We will be fighting aggressively for the resources for our communities and our education system. And we challenge policymakers and lawmakers to think first and foremost about the resources necessary to sustain and build communities. The first thought ought not be to cut those communities. Now, I'm also very hopeful. This has been a pretty amazing last 10 years if you think about what's happening, particularly in the United States of America, and who's leading. Our young people are leading. They're not future leaders. They're not just, being prepared to lead. They are the loudest and sometimes most powerful voices with the best organization. They have been telling us for a long time about climate change and their want to have it be different. They have been telling us for a very, very long time about gun violence and how it uniquely impacts them in their communities. They have been telling us about the horrific system of trying to finance higher education and have a lifetime of debt. And now they are telling us that they want to join communities who have been struggling for 400 years to be partners in the work of racial equity and racial justice. Our young people give me hope. And with that, I think today is a moment of hope. We want to announce to you today that after an incredible effort by more than 120 people on a task force assembled from regions all over the state, parents, students, teachers, counselors, mental health specialists, school board members, policymakers, business leaders. We've tried to create an inclusive group that has a lot of voice on how to open schools. The work was technical at times, but it was also substantive policy, and it was rooted in values that our school system and the systems we built to support our students is the most equitable thing we can do today. It does not mean it is equitable yet. There's a lot of work to do. But what we've experienced over the last 3 months is a state that chose continuous learning. We chose to try to engage at a distance while other states said, oh, that's not for us, we're going to shut down schools. We tried to push through that. That has been a disproportionate experience for families and students, and the very best thing we can do is get back to our schools. Today, I am telling you that our top priority for this fall is not some modified schedule. We'll talk a bit about that. It is not alternatives to face-to-face learning, but in fact, we are telling you today that in partnership with the Department of Health, the Governor's Office, Labor and Industries, we built a policy framework that will allow for our schools to open across the state this fall. It is, of course, a function of our health outcomes. We have to do our part. We have to wear masks. We have to maintain social distancing when and where we can. We've got to focus on personal hygiene. Our personal behaviors as individuals in our communities help shape the ultimate possibility. But the framework we're disclosing today and sharing with you today is a presumption that we are coming back, and every school district needs to prepare for a fall opening that is face-to-face. There will be health guidance that comes with this. They've been amazing partners in this. Probably the most clear will be face masks, face shields, face coverings will be required for everybody as a part of this. The science is very clear that this is a virus and a disease of droplets, and everything we can do to remove the risk of those droplets leaving our space and connecting with our peers or being on surfaces puts us at greater risk. So there's a challenge in this for all of us, and we have to do that well. Our calendars next year, we expect to be 180 school days and 1,027 average instructional hours. Those are in the law. We made extraordinary efforts to try to shape and waive a bunch of that this year. Our intent is that we will fully meet those obligations next year. The return is going to be significant in that it's going to take every school district to partner with their community in a local planning effort. Just as we have, the districts have been paralleling that, and they've got a lot more work ahead of them over the next couple months. They need to engage very diverse communities in their schools, particularly those who are very disconnected in this current experience, those who did not have a chance to learn equitably, those whose services need to be made up, certainly inclusive of our educators who themselves had their own struggles in this effort. While I'm here, let me just say clearly a huge thank you to our teachers and all of our building staff around the state who put their best foot forward through this effort. This was heroic and nearly impossible. But with 53 million American kids out of school, Washington State clearly demonstrated that we were willing to push through that as hard as it was and as difficult as it was in some places. The partners on all of this work, of course, are many. Huge thanks to WASA, our school superintendents, our school board members, our principals, and our labor leads from WEA, public school employees, and SEIU. 1925, it is a bunch of our early learning work. This will not be easy. There are lots of folks who will be concerned about this and may be afraid about the opportunity. Again, the science will ultimately determine this. Our presumption is that we're coming back, districts will plan for this, but the team who organized this work also recognizes that for some communities, the health guidelines may not be able to be met. Perhaps the social distancing can't be met given a particular way a school is configured. Or maybe we start in the fall and ultimately a local health authority has to shut a school down again due to a significant outbreak of COVID. For all of that, the group is recommending a continuum of possibilities, and they did explore a lot of things. But they have landed on a couple of options that they would sort of challenge the system to think about, not in isolation. These can be blended and mixed. But I would reiterate, these are places districts might want to think about should they not be able to open face-to-face. All districts, however, will both simultaneously plan a full open, which is our expectation, and the scenario where they have to shift back to continuous learning in a far more effective approach. Your questions will be essential in all of this. I think it's probably the best way to address a bunch of the details of the plan, but let me reiterate, we're opening this fall, provided it is safe. First and foremost, we have to keep our students and our staff safe. Department of Health has provided the guidelines to make that possible. We have added educational guidance to our system on how they can plan, how they can navigate their communities through it, how they can build that support. And we've made suggestions along the way for things that did not go well this year that need to be improved should districts have to flip over. I will pause here. I know we've got a lot of questions. I will conclude with a few remarks when we are done. But let's go ahead and grab some questions. And I think Katie's going to introduce individuals of the media who may have questions for me.
Our first question is from Hannah Kim, Q13.
Hi, thanks for taking my question today. I have several questions. I read through the report and you listed out some of the models, for example, the split model as well as the phased-in model. Could you kind of explain to parents so they can have a better understanding of what that really means? Give us some scenarios, please.
Yeah, thank you, Hannah, for the question. The question is really about those other models. Again, our presumption is we're opening face-to-face, and we think we've created the opportunity to do that safely for our students and our educators. Should districts not be able to, or they have to revert to a different model, split or rotating schedules is really a model that recognizes that in some spaces, maybe due to distancing, maybe not all students can be in place at the same time in our buildings. So it has the concept of, say, alternating schedules, an A-B schedule. Some students are here on Mondays, some are here on Tuesdays, and alternating. Could be by week, could be over a 2-week period of time where you're only essentially bringing in the students that the health guidance creates capacity for. Again, we do not expect that this will be the routine, but districts need to plan in case they have to do this. The phased-in opening is a similar concept, only there are definitely models where you bring perhaps all of your elementary school students back first. So you don't quite have the capacity and you haven't met the health requirements of your local community, your local county health group. So you bring back elementary students, or you bring back students who are most distanced from educational justice. Maybe you bring your students with disabilities in for the intensive supports they need. You prioritize, if you have limited space, who comes first, maybe revert more attention to students who are in high school to online models until you can safely bring everybody back in spaces. And then continuous learning 2.0 is a recognition that there may be scenarios where everyone has to be online again, but we need a lot more shape and structure around that. So professional development for our staff so they can deploy more effectively. Districts need a plan that is inclusive of really driving to a single platform so that parents are not navigating 3 or 4 different learning platforms. It's assuming things like maybe split schedules while we're at a distance. Elementary students with intensive supports in the morning, face-to-face with teachers, and their independent work would be in the afternoon, and then you reverse it for our middle and high school students. We found that a lot of families were, needing to all be on with multiple children and maybe only 1 or 2 devices. And so continuous learning 2.0, again, only if we have to go there, is a significantly more sophisticated and developed way of structuring learning at a distance. So it's more equitable and more fair for families.
Chris, follow up to what you just said. So are you saying that many districts will be able to go back to a traditional form of learning, or are you saying that most districts will probably have to pick from one of these 3 models?
No, Hannah, most districts are going to go back face-to-face in a traditional model. What I mean by traditional is that we get to go to school, we get to get on buses, we get to engage our education system as it would be quote unquote normal. Now it's going to have social distancing requirements, and it's going to have a face covering requirement and hygiene protocols and some screening protocols as students come in. And so the primary opportunity here is that we're opening. What I'm trying to make clear is our Department of Health still has significant role in determining if a region can't do that because of a significant outbreak. The guidance is pretty clear. Anyone in phase 2 or higher, they've got that opportunity. In fact, we're opening this summer. We're opening now, literally today, in places where they can create some educational opportunities. If you're in a phase 1 or what they call phase 1.5 or modified open, there may be additional restrictions beyond this general guidance from the Department of Health that a local health department will require. But no, the presumption here is we are coming back. The understanding of the disease, the way it has been modeled, the incredible response from Washingtonians. We went from clearly the most infected state in the beginning to way, way down. We're 2.5% of the US population. We're 1% of the loss of life, which is still too much, but we have responded remarkably, which gives us this opportunity to open face-to-face, but we have to keep it up. All 3.
Chris, I understand that we are coming back to some degree, but are you saying when I say traditional, I'm talking about pre-COVID, where every single student comes back to every single classroom at the same time. That's what I mean by traditional. Do you see any districts doing that? Is that possible?
Yes, Hannah, I'm telling you that virtually all districts are going to have that chance. What the reason I'm saying it's not traditional is even in that scenario, you're going to have desks 6 feet apart, and the teacher might have to move their desk to a back wall, and you might need students against a window. And some classes that are large might need to be in a gymnasium. So it's not going to be the business as usual, but it is possible. And we expect that a 2,000 student school district is bringing all 2,000 students back. That is the expectation. Districts need to plan for that. The Department of Health, along with the CDC guidance, has given us that opportunity if we follow those health protocols. That is the opportunity that sits before us.
Thank you, Hannah. Next question is from Katie Gillespie from the Columbian.
Hi, Chris. I did follow up on Hannah's point. Is there discussion around facilities at all at this point, or school districts that maybe have older buildings or buildings that just aren't going to be able to accommodate all students with social distancing protocol in place?
Yeah, thank you, Katie. It's really going to be a function of the local school district making that determination. It's more of a square footage issue right now because distancing and face coverings and hygiene, so hand washing, um, is really the driving three forces on the health side that make the opportunity possible. It is possible that there are school districts who don't have the square footage or the configuration to make it work. But if you've ever been in a school district during construction, you know that those certain classes get moved to the gym and those spaces are no longer allowed. And so then there's surge spaces and other things brought in. Districts are going to have to be remarkably creative. The obligation in this plan, by the way, is that local school boards will adopt a back to school, uh, um, they will adopt a back to school requirement. They'll take it as a board action in a resolution, and then that will be submitted to the State Board of Education and OSPI within 2 weeks of opening. We trust they will meet those recommendations because they will always be subject to the local Department of Health. And any district in a phase one or modified phase one will need additional buy-off from their local county health department. But no, we're coming back. Again, where it is safe to do so with all of the proper protocols in place. Districts will make the decision how they configure their buildings and what's possible for them. But this is why it is such essential work now that communities really come together, and lots of people who want to see schools open or are nervous about it, they get a chance to really engage their local school district, their superintendents and their local boards on that planning process over the summer.
And then one other thing, this is maybe more of a technical finite question, but one concern I've heard from a lot of families or a lot of local folks is what happens when a kid has got maybe somebody at home with a pre-existing condition or is more susceptible to getting COVID-19. Is there going to be some flexibility for schools to have some kids on a distance learning model and some kids at school in acknowledgement of those situations?
Yes, most certainly. And school districts have that today, right? We certainly have a flu season every year, and this is not the same. COVID is not the same. But the parallel I draw is that there are students who are vulnerable themselves or have family members that are vulnerable. The expectation that we will have is that, of course, districts have lots of flexibility to design that, particularly if there's a large segment of their population who's nervous and doesn't want to come back. Districts will make the hard choice of how to structure likely, continuous learning 2.0 for those students, or bring them in for select classes and give them distance to opportunity to learn at a distance and others. Districts will make that determination on how to do that. We know that is a reality today, and it will certainly be a reality as we go forward. But districts will make that accommodation. They do that today. It's challenging, of course, but our expectation, though, is that every student will receive their basic education. So they will have that opportunity to learn in one form or another.
Thanks, Chris.
Thank you, Katie. The next question is from Kelly Azar from KATU News.
Hi there. Sorry, forgive me if this has already been asked. My internet dropped out for a second. But when it comes to students who maybe have a health concern, or I've spoken with a number of parents who have children who are autistic, who they struggle to explain or get to wear a mask while out in public, how are we going to approach that if there is a child who either can't or refuses or whatever the case may be.
Yeah, thank you, Kelly. The CDC guidance in this case is being referred to by our Department of Health. And let me be clear, this is Washington State's guidance. So if there are folks out there who read the CDC and say it doesn't allow this or doesn't allow that, please focus on our Department of Health guidance for schools. It is unique to us. It has been crafted for our opportunity here, given the opportunity to keep safe and come back to school. In this case, they're referring to CDC guidance when they talk about face coverings. And there are exceptions. There are students who cannot wear them safely. There are students with pre-existing medical conditions. There are students who could not remove them safely if they needed to. And there are provisions for that. It means you need to come up with another a model for those students. It may be that the teacher, particularly in a one-on-one setting, as you've described, where there may be speech therapy supports or something, maybe the teacher will need additional protections in that case, and the student wouldn't have to wear a mask. That is that subtlety that will be worked out locally. Again, we expect for the vast bulk of students, they're going to step up, they're going to do this well. Our staff will do this well. Everyone will need face coverings. There are students who cannot do it. And the exceptions are in the guidance, and we understand that districts will make the appropriate accommodation to support that student.
Thank you, Kelly. Up next is Hannah Furfaro, Seattle Times.
Hi, thanks so much for hosting the call today. When I was first reporting about the work group, I remember that there were 7 scenarios for returning to school, and one of them was described as school as usual, and some of the documentation seemed to indicate that that was very unlikely. And I know that you just said that school certainly won't be as usual when kids go back, but I'm wondering if you can talk a little bit about what led up to this decision to return to sort of school as usual, or a version of it, because it seems like the decision to have most districts go back looks closer to that than any of the other 6 scenarios that were weighed initially.
Yeah, thank you, Hannah. Yeah, what we tried to describe in the beginning, and we're using a little bit of terminology that we got to clean up for you all, but business as usual to us was, hey, nothing is going to change. We come back to school, everyone's good, no face coverings, groups of students all packed together. That is not a possibility. That is not a scenario that is viable. That is not moving forward. What has given us this opportunity to come back, and what I mean by that is come back to our buildings, but with distancing and more space and face coverings and all the protections, is that the understanding of the virus itself has undergone enormous research, even in the short time that we have experienced it. We knew in the beginning from our experience in China and other parts of the world that it wasn't particularly a disease of fatality for young people, although there are some who clearly are at risk. But that gave, I think, scientists the opportunity to really map and understand what's happening with young people. The reason the face coverings are so critical is that while our students are quite safe, it reduces the spread and therefore reduces the possibility that they bring that to a parent or a vulnerable grandparent or somebody at home. So this is an amazing moment for our students to embrace their contribution to a larger societal good. And we expect them to do that. But yeah, the science is telling us this is a real possibility, and it can be very effective. We had a group that we used in this process as a partner, Kinetic West, and we thank them for their work and the support that the business community in particular was a part of in helping support that. They looked at more than a dozen countries around the world that have closed and subsequently reopened. They've looked at more than a dozen states in the US. We went all over the world, quite literally, in terms of phone interviews to understand what they did, how they did it, what worked, what did not work. That partly shaped our ability to say, hey, there's certain things we can't do that didn't work in other parts of the world, but when we follow these frameworks, and the Department of Health understood those and supported those, and when it was consistent with the CDC, we realized there was an opportunity here to do this very, very well, but always with that contingency that in some communities you may have cases, if we can't do it well in the larger community, that will cause the schools to shut down, in which case we've got to move to continuous learning. We've got to move to those flexible models, and districts need to plan for their open and then be prepared for that alternative scenario.
Up next is Hannah Scott from Cairo Radio. I think I was muted when I said that. Up next is Hannah Scott from Cairo Radio.
Hi, thank you. Hi, Chris. A couple of questions. First question is, you speak about working to end the opportunity gap. I'm curious, it's been an effort underway for a long time to try and do that. How would it be different this time around as we reopen schools? And what makes you think it's possible given the recession and impending budget cuts?
Yeah, thank you, Hannah. What we know for sure is that distance learning is fundamentally a disproportionate impact on students who can't connect, students who may not have the supports they need. The model that we were in was driven by the need to close, and every state did that, and 1.6 billion kids around the world found themselves in that situation. So the opportunity to come back to school is certainly our better opportunity, given that we can do that safely. That has the most impact in the short term of at least bringing back those supports that are there. What we are challenging districts to do in the guidance is take this as a moment to really rethink, right? We re-examine learning standards. We re-examine supports while we were at a distance. We re-examine grading policies. We're challenging districts to think about this summer, not just as a way to reopen school, which is clearly a priority, but what did we learn from this moment that creates a more just opportunity for our students? We have also been working with Office of Financial Management legislators to get our federal dollars, our COVID response dollars approved, and we think we're very close on that for districts. So there's a potential here for several $100 million to float our districts very soon so they can do those intensive supports for, say, students with disabilities who missed out on the opportunity. They can do important work in screening students for social emotional learning needs. There is a chance here to reform our system, albeit, rapidly and not in totality, but they should be thinking about those things they learned along the way to do this very differently. Obviously, for districts who have to be back in some sort of continuous learning model, there's another opportunity to say, hey, I've got the space and the capacity to serve most face-to-face. The equitable thing to do then would be to really differentiate your supports so that the students who need it the most get it. That's the opportunity that's in front of us. And of course, there are much larger opportunities over time in terms of connectivity, which we are still working. Districts to this day are getting hardware and connectivity for students who need it at a distance, but also need it to be successful in a general traditional model. We have put a lot of dependence on technology for students to be successful in traditional learning models, and we're transforming that right now. That's the opportunity that's in front of us.
Okay, and then also, what are the plans for any students that might have struggled or gotten incompletes in this current situation that we're in as we head into the next school year?
Yeah, thank you, Hannah. That's one of those great opportunities where, the decision that we made at the state level to eliminate the F grade this last term, it was just so inequitable in terms of the connectivity in part that we told districts your option in that scenario is an incomplete. An incomplete by definition is a commitment of the school to re-engage that student to ensure they get the learning and demonstrate the learning to get the grade or to get the advancement in that class. So we see districts already creating models for return where that's where they're going to spend their summer opportunity and summer resources, which again, this guidance also covers. We are available this summer within budgets and within the decisions of local districts. But they're doing that right now. We're seeing some innovative programs, we call them jump starts, where they bring students back before the regular school year starts to really be intensive and catch them up. We often see this in mathematics. There are districts who are thinking about and may decide that they're going to bring students back in the classes that they left last March. And that way, that teacher knows them best. They can really engage and understand where there were deficits in the learning, do some intensive catch-up and assessment, and then they have a more complete picture on how to really have a successful handoff of that student to the next grade or the next teacher in that content area. So we're seeing some pretty cool innovations out there. Those are strongly recommended in the guidance right here. It will depend obviously by district and resource, but there's a real focus on students who got incompletes. I believe this is one of those innovations that could be enduring for our state. If you believe in learning standards, then it's almost unacceptable to give an F. It is simply not okay. If the student is engaging and trying, it means they need more opportunities to learn content. We want them to master the learning, and it isn't about some artificial sequence of time where we say, no, your chance to keep learning has ended, you get an F. It could be, and we will expect to continue to work with districts to essentially eliminate that practice over a period of time.
And then just last one, finally, what options are there available for those families who don't feel safe sending their kids back to school next year?
Yeah, that's going to be one of those real complicated scenarios for districts to think about. Many of them have the opportunity today. We also have sort of centers of excellence, if you will, in distance learning where students can already be in what we call an alternative learning environment. These tend to have a lot less direct instruction. It's very independent study in its current format, but we've got very successful districts and partners in that work. So students will have options to do that, and they've been taking those options this spring in larger numbers. Not a ton, but certainly some more activity. Districts are going to create a similar opportunity is my expectation. They know there are some families nervous, and it could be, like I said earlier, that there could be some space and capacity issues that will compel them to identify students who will need a better opportunity at a distance. And they'll create those models. There are staff, I think, out there who are anxious to do that. We have staff in high risk categories. It will be really up to them in consultation with their doctor and whether to come back and get the proper support they need for protection. But it could be that there are staff who do not feel safe coming back and who will need an accommodation, and aligning them with some students who may want more learning at a distance is a great opportunity for districts. That's why we're going now. That's why we didn't wait till July or August on this and really pushed the systems here in Olympia to work together. And they've just been awesome partners at Health, the governor's office, L&I. We wanted guidance now. We know it'll evolve and change, but districts need June and July and August and part of September to keep shaping those plans in a way that best fits their community.
Thank you.
Thank you, Hannah. Next question is from Veronica Barriga, KNDU TV.
Hi, Chris. So I know you touched on it, but can you clarify a little bit more about going back to school in a county where phase 1 is still there? Because I know the majority of the state has moved forward, but there are a few counties still on phase 1. So just to be clear, are they not going back to school, or they can go back to school based on what the health district says, but then that means further regulations, or can you just clarify that?
Yeah, thank you, Veronica. Yeah, your latter summarization of it is accurate. The opportunity here is for everybody, and there's general health guidance that applies to all counties, no matter what. In phase 1 counties, or what they're calling modified phase 1 counties, there could be, so it's not a mandate from us, but we are creating the expectation for districts that those counties, in particular, those county health authorities, they will get to make some additional regulation on districts if they choose to. And it's because of the incidence of COVID cases, obviously, and the potential risk generally due to the density of populations in those areas. So yeah, everyone gets the opportunity to open. This general guidance applies to everybody. If you're in a phase 1 county, you are likely to be subject to additional health regulations by your local Board of Health.
Okay, great. Thank you.
Thank you, Veronica. Next question is from Jerry Cornfield, Everett Herald.
Superintendent, I was hoping you could touch on, elaborate on 3 topics. First, sports. In particular, what do you envision for the fall? Will high school football games be returning, and other sports? What timeline for a decision? And second, school buses. What do you envision actually happening from a family's home to their child getting on a bus and arriving? What do you envision if a child doesn't have a mask when they try to get on the bus? And then just funding, elaborate on the state funding. You say you don't anticipate any problems with state funding, and I'm wondering if you have that assurance in writing.
Thank you, Jerry. It's good to hear from you. Sports is one of those very specific areas that we had hoped to put into contemplation. Well, we did put into contemplation, could not get there on guidance for right now. Our athletic association or our academic WIAA is in partnership here. They've got a real commitment to this, and I think they built an initial framework that may make some sense. But given this guidance, we also might be able to simplify it. We're going to continue to work with Department of Health on this. There's some limited activity available already under Governor's proclamation for some community-based groups to use our schools, but high school athletics, middle school athletics, supported by and in coordination with the school districts, it does not have guidance at this time for fall. We're going to keep working through that. That'll be one of our very next things. Sports are a very complete package for a lot of students around what it means to be engaged and successful in school. So we expect to get there. We expect fall sports to be available just as we do fall opening for school and academics. That guidance is not part of this at this time. We're going to keep working on that right away. So we hope to have that guidance out here in the next several weeks, but that could take a little bit longer. You mentioned football. There are certainly sports more conducive than 50 or 100 people on a sideline packed together and certainly on the line of scrimmage. And so it kind of comes down to some of that stuff, is how often is that contact? What is the risk? The Department of Health will once again drive most of that regulation. The buses here, the regulation from the Department of Health is that we can be on our buses Again, we did not follow the strict CDC guidelines, which may be confusing to people. Our Department of Health took the totality of their research and understanding and said, with proper additional things in place, like screening and like face coverings and keeping windows open as much as possible on buses and frequent cleaning, given the duration of that time, they're not 6 or 7 hours together in space with each other, the opportunity to transport our students is there. We're going to recommend that districts rethink the boundary in which they transport. Most districts have students walk or bicycle or get taken to school by a parent within a certain boundary. It may be that based on that local development plan, that local community plan for schools, that they're going to increase that radius. I think parents should expect to keep their kids with them as much as possible and bring their kids more consistently to school and pick them up as parent pickup, but that will be up to a local planning process. We can transport our students on buses. We want to protect our bus drivers. So one of the things that you sort of will observe in the labor and industry guidance is that needs to be addressed in local school districts between the bus drivers and the school administration. You're going to see more plexiglass if it can be done safely. You're going to see bus drivers have the ability to protect themselves more. They will also be wearing masks. They're going to make sure that accommodation occurs so that it's safe. And then state dollars. We have mapped with legislative staff this question of our budget stable next year. 96.5%, maybe 97% of all the basic education appropriations that we subsequently send to districts are defined as basic ed following the McCleary ruling. So we know there's still some risk out there, but this is such focus in a bipartisan way of our legislature over the last several years and the governor that we feel very confident those resources will be there. We have talked to legislators, we've talked to their staff, we've run our numbers by them. Our districts will have what they need for basic ed, and that's why we really encourage them to get their fall plans underway. But there's some buckets of money we'll have to fight for because it's not in that category of protected. As you heard me say, though, austerity is a practice of privilege that we have done through every recession in time. And if we're learning nothing from this moment, we should ask different questions of ourselves. What do we need to create success for our students, for our economy long term, and the ultimate success of our state? Then what resources are required to do that? Then you ask yourself whether we can be more efficient in the system to provide that. If not, can we then ask those who can afford to pay more to do so? And only then, if we can't achieve our goals, do you think about cuts. But we've got to stop believing that our first expectation is reducing the very services, particularly in education and in human services, which are foundational to the success of our communities.
Thank you, Jerry. Up next is Ashley Gross, KNKX.
Sorry. Okay, two questions. I was wondering if the moratorium on standardized testing will continue next school year. And also, if school districts do have to do continuous learning, like distance learning, will there be a requirement that teachers do online like instruction rather than just online check-ins? Because a number of parents I've talked to have been frustrated that the kids are not actually getting online lessons or instruction.
Yeah, so to the question of assessments, our federally mandated assessments, those that are required of us by federal law and subsequently guided by our U.S. Department of Education, they've only waived assessments for the year that we're just concluding. They've not yet made a determination about next year. So our guidance to the system is you need to be prepared to offer the assessments that we are required to do in the state, particularly the Smarter Balanced Assessment, 3rd through 8th grade and in 10th grade, math and English language arts, and then 3 times over the course of a student's career in science. We would like to see those waived once again. We want to move, at least in the short term, if not more permanently, to a far more budget respectful assessment system called the NAEP system, National Assessment of Educational Progress. It's a sampling methodology that gives us more reliable data on state performance and gives us the actual ability to measure our performance in the state against other states. Nothing in the current system actually allows you to do that except NAEP, and it can be done at a fraction of the cost. What that does mean, though, is we still need to assess appropriately our students and do what we call formative assessments, where we're assessing along the way to check into their learning so that we can reintroduce information and supports for students. That has historically been the role of our educators, and we need to get back to a place where our teachers are the respected professionals they deserve to be, where they make determinations about student learning against standards. And let's go to the more efficient NAEP system long term to really hold states accountable and to be able to compare states. There is a better way, and members of our congressional delegation, I'm challenging them to step up and lead on this. We got to get away from this test obsession. Incidentally, we've spent $150 million in taxpayer money over the last 5 years just on our federally mandated tests in the state, and that's just what I spend at OSPI. So there's a big opportunity here. Should we turn to continuous learning? Yeah, the expectation here is both professional development for teachers. There is a difference teaching online versus face-to-face. There is a challenge here that districts need to get to a single learning platform, at least a single learning platform by grade. So if their elementary is different than their high schools, that can be okay. But it is not acceptable for a high school student to be trying to learn online and have 5 different teachers with 5 different learning platforms. So that's part of the expectation. If we can get approval from the Office of Financial Management for all of those federal dollars, including the dollars geared for WSU, go Cougs, geared for OSPI, that wasn't subliminal, Huskies, maybe it was. If we can do that, we have intention to support professional learning for our teachers on these platforms in all of our 9 educational service district regions. So we have a very intentional plan for doing more PD for educators, but those dollars for OSPI have not been approved yet by OFM, and we'll continue to work with them to try to get those approved.
Thank you, Ashley. Up next is Allison Needles from the News Tribune.
Hi, thanks for your time. So I had a question about the cloth face coverings. Are those going to be provided by school districts, or will families have to find a way to get those?
Yeah, thank you for that, Allison. So the cloth requirement, it's really a face requirement. A cloth will be the presumption in most places, but the Department of Health guidance from our state also makes an opportunity out of face shields. There are times when particularly intensive language supports, for example, or where instruction has to be really clearly articulated, or some students need to read lips, where a clear face shield will be an opportunity. For our employees, what has been worked out with Labor and Industries is that is an expectation of employees, and therefore the employer will be paying for all of that cost. We expect school districts to work out locally how students are provided a face covering. As you can imagine, we don't really let students come to school without shoes, but we don't pay for their shoes. We do sometimes when students can't afford it and they need supports. So our expectation is that for students who show up and do not have a face covering, the district will absolutely need to provide that opportunity. But I think it's quite possible that most districts will create that expectation in families, and students will want to customize these, right? They're going to want something that works for them and that fits them and is appropriate for their family. So there is no recommendation or requirement by Department of Health Guidance or LNI that a one-size-fits-all purchase of districts for students, but our staff and faculty that will be provided by the districts, and then local planning efforts will determine how students will be accommodated for that. But yeah, everyone's going to need to wear face coverings.
Thank you, Allison. Up next is a follow-up from Jerry Cornfield, Everett Herald.
Yeah, could you just talk a little bit about the time frame for reviewing these plans? If I understand, they need to be in at least 2 weeks before the first day of school, which tends to be right after Labor Day. I could foresee a big crunch for both your agency and State Board of Education. So how's that going to work? Are you going to actually visit schools to see that they have square footage set aside, et cetera? And then during the school year, must they also get approval for any changes they make, whether they add more students or go back to distance learning?
Thank you, Jerry. These plans are going to be adopted locally. Our state has a very clear legal framework that our local school boards, they matter a lot. They set policy locally. And so that is where the locus of control is. That is a public process locally. We want those planning efforts to be local, but school districts are actually going to decide their openings. We want them to have it on file with us. Both for purposes of ease for access for families in case they can't get it from their district. Those of you in the media often want us to concentrate that. There is some law currently that districts have to essentially attest that they can meet the basic education requirements. That is a law where they owe that information to the State Board of Education, which is why we're partnering on this. So we will be checking to make sure that they have completed the plan and all the required elements are in it. We're not going to do quality control. We don't have the resources. It's sort of more like how we would open restaurants right now. Not every single opening is getting a fine-tooth comb. You can open, you got to follow the guidance, people do the right thing. And then if there's an issue though, obviously local Department of Health can go in and say, hey, there's been a complaint, we can check this out. It will fall more like that, where districts will make this decision. They know their communities best. They will adopt these in public processes. We will have them on file. We do not expect that they will have to go through any formal process as they amend it. This is going to be a very fluid situation, as it will continue to be until we get a really high quality vaccine that's sustainable. So that's the plan with that. Those districts in those phase 1 or modified phase 1 counties, again, they'll be submitting the educational components to us, but they will have to work hand in hand with the local Department of Health to get their blessing to move forward. And that is likely to be also in consultation with the State Department of Health. We want to make sure that everyone understands where there are areas perhaps of greater risk, and there needs to be coordination around that.
Thank you, Jerry. Up next is a follow-up from Hannah Ferfaro, Seattle Times.
Hi there. I'm wondering if you could talk a little bit about the push for districts to have some sort of universal assessment of students to get a sense of their baseline and where they're at. Do you have any assessment in mind that you're recommending? Will there be any requirement that districts do this? I could see why it would be important, but I'm wondering if you have any more specifics.
Yeah, so there will not be a single system statewide, and we do not require or mandate a single statewide system. The guidance builds, if you will, an opening checklist. And so when they submit those plans and they approve them locally, it is one of those component parts that we will ask them to address in their plan. It will be up to them though. There are different screeners, and there are screeners for academic learning, and there are screeners for understanding social emotional learning gaps, and there are screeners on students' mental health and well-being. And districts will use those as they think is appropriate for their community. It will be part of our expectation that they are addressed in their return to school plans, but they will decide what those tools are, how they're going to deploy, who will administer those. It could be that it is in classrooms as students come back. It could be that our districts really want to identify students who they knew needed additional supports when we went into closure, or maybe they truly lost contact with them during the closure. We'll let that be a local decision on this one.
Thank you, Hannah. Up next is Hannah Kim, Q13, with a follow-up.
Quick couple questions here. So class sizes, I know summer camp, for example, they put one teacher to 15 students. And is there a recommendation of class sizes moving forward? I know a lot of like kindergarten classes, not uncommon to have 26 kids, and it's kind of hard to socially distance 26 kindergartners. So there's that question. The other one is there a possibility of longer school year, considering that if they do go into this model split schedule type of stuff, that could be possible. And the third real quick one, September 15th, that's when health experts are now saying a second wave is going to happen. I don't know if you knew that, Chris, because the information just came out today. So I don't know if you want to have to say anything about that.
Thank you. So I'm going to go in reverse order, because then you're going to remind me of your first question. A second wave, yeah, we're already seeing cases climb again, and that is not unpredicted. Most of the health experts that we are working with assume that as you open up economies that you're going to get some rebound in cases. If you recall, and I don't have my whiteboard, but if you recall, it was all about keeping our capacity in our acute healthcare systems from being in a crisis mode. And obviously we continue to be successful at that in our state, but we've got to be very careful of this. Opening up the economy was not go back to everything you were doing. It was get back out on vacation appropriately with limitations, get into restaurants, get back to work with face coverings, with hygiene practices, right? With proper social distancing as much as you can do. When we do that stuff well, we keep our numbers down and the opportunities there. If we do not do that well, then it will spike. And again, there are 3 people in this state who can close a school: a local health director, a local superintendent, or the governor. And if our cases aren't under control and we can't do this work together, then we run the risk of schools not opening, or maybe just in some areas. But that is something we're going to be literally tracking with Department of Health along the way. The school year. Our recommendations for districts have a couple components here. We expect them to build calendars that include a lot more days like they would normally build in the event that they miss school. So today, districts often build in several days for the potential of snow. Now, you'll hope those happen early in the season because you've built in a snow day, let's say, towards the end of your year. And if it snows and you miss school, well, then you go to school on that day in spring that would normally be scheduled off. If you didn't end up with snow that year, well, that becomes an extra day off for kids and staff. So we're asking districts to build a longer calendar, if you will, of potential days. We're not changing the 180-day school day requirement or the 1,027 instructional hour requirement. We're challenging them to build in those things they have been very used to doing for years for other events besides this. So we do expect calendars to be considered. Those are subject to local collective bargaining, so that needs to be a partnership of local education associations and ultimately administrations. But we expect them to be really thinking about their calendars differently to accommodate this. The first question, I told you I'd forget it.
Class size, Chris, is there any recommendations, class sizes?
Yeah. The Department of Health, again, was guiding us on all things that were a function of health, individual health and public health. They do not have a number in there. They don't pick a percentage capacity number. Their guiding framework for us is you need to have a plan that includes 6 feet. And of course, that gets violated, right? Kids get up and go to the bathroom and they walk past their friend. That's why we have face coverings and frequent washing. So it is not some steadfast thing you have to follow every second, but you have to have a plan that accommodates that as the standard. Our average classroom is 900 square feet. That's not true everywhere, of course. And we can accommodate our classes, our traditional class sizes in that, but you got to do things differently. And it's a little unfortunate. If you've been in a kindergarten classroom or a first grade classroom, it's the most spectacular thing to watch amazing teachers who intentionally build practices about being in seats, and then we're on the carpet doing math, and then we're singing, and then we're exercising, and then we're on bouncing balls, and then we're spelling. And they use their classroom as just this incredible exploratory space. Unfortunately, that is not going to be the case this next year. We can accommodate our class sizes we have for the most part, again, not everywhere, but this is going to be a unfortunate scenario where desks are very aligned. They need to be facing one direction. That minimizes spread because then students aren't facing each other as droplets are revealed. And so it's going to be a little sterile for a year. I'm going to be honest about that, but it's our opportunity, and it's still our best opportunity for equitable learning. But we can accommodate our students. Again, there might be some places they can't do that and they got to think differently. But teachers, you're going to get in your classroom soon and you're going to have a tape measure and you're going to help us here because we want you back in those classrooms.
Thank you, Hannah. Our last question is going to be a follow-up from Veronica Barriga from KNDU TV.
Okay, hi. Great. Yeah. So follow up for phase one counties, because the area that I cover, they're nowhere near. We are nowhere near, the state targets and metrics. So I do worry about that. But the question is, you mentioned that the health district or health departments can impose additional regulations for the kids going back to school. But what would that look like? Because if the baseline is face coverings, social distancing, and hygiene, I'm just unclear about what more we can do on top of that. So do you have any specifics on what that looks like or what that means?
Yeah, so I don't want to speculate in any particular area. I really don't. But the kinds of things you see in those sort of added restrictions, for example, are, they make strong recommendations to move meals in a way for a lunchroom that creates far more distancing, or outdoor temporary space where students can spread out, or they're grab and go meals, for example, because they don't want students touching utensils. They might have additional restrictions that say, hey, in this county in particular, given how what's happening, they may not allow even where 6 feet is appropriate in a space. They might have a larger restriction, which would cause the schools to use even bigger use of their facilities. Or maybe they're going to say, you're not opening up in September because we've got this enormous spike in cases. We haven't moved out of phase one, which is why districts are going to be required to have an open face-to-face plan, and then a switch to obviously some sort of modified plan that includes distance learning. Those are the kinds of things that local health can do. It may be that they're more aggressive about screening students as well. And, we didn't talk a lot about that, but there is an expectation for screening. And again, it's flexible. The districts will decide this. This can be very intensive screening every morning. This can be observational screening after some training of students who may demonstrate symptoms. This could be attestations for families. I will say, without question, as parents, we all want our kids in school, and a lot of us have made judgments in error to say, well, I'm not sure, you've got a slight fever, go to school, and if you're really sick, go to the nurse and they'll send you home. That's not an option. That is not an option right now. We need families to keep their kids home who are demonstrating symptoms of any illness, particularly if there's fever, sweats, fatigue. And that's all in the guidance. So yeah, phase one counties are going to get some additional scrutiny, and local health departments will craft a plan with them to open, or if it really isn't possible, they'll say to them, because they do have the legal authority, we're not opening yet. That's going to be up to your local county health folks.
Thank you all for joining us. That concludes our media availability. The recording of this will be available on TVW as well as OSPI's Facebook page if you joined us late. And feel free to reach out to us if you have any additional questions that weren't covered today.